I fought hard, like so many young people are fighting hard this day, to let my background not be the thing that limits me, but be the thing that actually fuels me.
Welcome to Insider Career Conversations, a podcast that highlights unique careers and non-traditional education paths. I'm your host, Sylvia Juarez, an education consultant and first-generation advocate. This season's conversations touch on immigrant community advocate roles and how at times they require a specific type of community engagement. Each episode features guests well-versed in their field. We discuss their personal and professional journeys. My co-host this season is Yadi Ortiz. She is someone I admire and have worked with for years to support undocumented students. In the past, we have focused on higher education, which evolved into recognizing the informal information and career advice students need to be successful in college and beyond. Now, we've reconnected and we're bringing those conversations with new perspectives. Let's get into it. Yadi, can you tell us how you're doing today?
Hi, Sylvia. I'm doing really well. I'm excited to just get things started. We have so many things to do, right? And on a daily basis. But I'm really happy to be here with you today, Sylvia, and talking to a really special partner of Pre-Health Dreamers that we have been working with for a few years now. Today we have Dr. Lucy Ogbu Nwobodo. She is the assistant professor at UCSF Department of Psychiatry and Behavioral Sciences and Associate Program Director of the Psychiatry Resident Program. And I'm really excited to bring her into this partnership because we have been really trying to focus and doing outward facing training for health professionals who are seeking to better support undocumented patients in their hospitals or in their clinics. And so we're trying to really expand our training, strengthen it for a lot of health professionals, but not just them, also students advance in their health professional programs. And so I really am excited today to bring her on board because I think Dr. Ogbu Nwobodo really has a lot of background and experience in working with a really special topic that I hear about a lot. So hello, Dr. Ogbu Nwobodo. How are you doing today?
Good. Thank you both for having me. It's a pleasure to join you today.
Thank you so much, Dr. I'm going to say Dr. Lucy. Is that okay?
Yeah, that's perfect.
Excellent. Thank you, Dr. Lucy. So I'm excited to hear about your background, but I also am very interested in the conversation about competency and humility.
And, I think it's something that, we should all be trying to wrangle with and really try to learn how to understand what these concepts are. And I'm grateful that we're creating, the space for it. Many people may or may not have heard of the term cultural competency as it relates to, as Yadi was saying, supporting, immigrant populations or supporting patients from different backgrounds. And, historically, cultural competency was an approach that was created to help those in the healthcare profession learn about how differences like race, social class, sexual orientations, other markers that we consider differences shape interactions between health professionals and their patients. So it was focused on helping the clinician identify things such as bias and helping them improve how they communicate with patients from different backgrounds. These could be patients who are immigrants. However, in recent years, there's been a reevaluation of this idea of cultural competency and looking at, is this actually enough for us to help patients have better outcomes? Is this really addressing the issues that we're seeing in health disparities and things like that? And there's been a new term that has now become more standardized, which is structural competency, a framework that seeks to actually help encourage healthcare professionals to recognize and analyze and then intervene on structural factors that impact health disparities. So, what are these structural factors? These could be policies, right? Economic systems, things like cultural norms, ideas that we have as a society that help stratify who gets access to care, who gets treated better than others, whether it's because of your race, ethnicity, religious affiliation, immigration status, gender identity. There are structures in place in our systems. There are policies in place, right, that actually create the impact that we're seeing. Their healthcare delivery systems, their markets, institutions, all of these are bigger factors that lead to the downstream effect that we see in the patient interaction. The one-to-one patient interaction is not enough. Teaching someone to become sensitive about someone's background is not enough to address the issues, because unless we look at the structural factors that lead to that outcome, we're not going to actually make a difference in patients' health, overall health.
I think it's important that as we couch this, I feel, because my background is in admissions, competitive admissions in terms of the University of California and then the higher level of Ivy League, it's something to be said for that structural competency that needs to be appreciated at the admissions level. So is it safe to assume or to say that this structural competency can be across any range of professions?
Absolutely. It is not just something that is limited to the health or medical profession, right? In education, there are factors that impact who gets admissions to school, whether they went to, a school district that had more funding, what leads to those funding disparities, right? Whether they live in a neighborhood that had limited access to food, what leads to those food insecurities. So all the things that impact students and their trajectory towards an educational system has to be addressed. And that's a place where structural competency can actually come into place in the educational system.
And can I add a little bit something? So right now we're seeing all across higher education, we're seeing it in healthcare. We're having a lot of conversations around diversity and inclusion. How does this connect to each other?
I think there's been, the umbrella of diversity, equity, and inclusion has been also evolving in recent years. I think for the longest time, many of us who have gone to a DEI training, as they're called, are taught like, okay, so here's how you understand implicit bias. This is a bias that you're not conscious about that may affect how you interact with people from different backgrounds from you. Here's how you maybe look at microaggressions, things that may be negative discriminatory actions towards the people who are different from you. And there's been a lot of these things that really came to the forefront, post, the George Floyd summer of 2020. There's been, I would say, an exponential growth in DEI offices, DEI trainings, DEI discussions. And although I appreciate, the focus on teaching individuals on how to be better allies, right? The word allyship has been used so many different times, how to teach us all to work better with each other. If we don't address the structural bases that affect the impact that people have. So we live in a white supremacy society, which is a society that has been created and functioning under the guise of whiteness being the norm, being the baseline, and everything else being the other. And within that, there are principles that lead to negative outcomes, like structural racism, right? The ways in which society has structured itself so that there are people from different backgrounds are then being discriminated against. And if we don't address those factors, we can never truly, for me, make a huge difference in DEI. And I want to take a moment to really define, for those who are hearing this term for the first time, what structural racism is, because I think it's important that we understand these terminologies. Structural racism is a system, right, in which public policies, our institutional practices, how we work with each other, our cultural representations, and other norms work in various reinforcing ways to perpetuate racial group inequity. This system really looks at our history and culture and have allowed privileges associated with whiteness and disadvantages associated with color to endure and adapt over time. It's not something that a few of us or a few people or institutions choose to practice. It actually is a feature of the social and economic political systems that we all exist in. Structural mechanisms, it doesn't require the actions or intentions of others to function. So even if we eliminated all interpersonal discrimination today, we went to all these DEI training and we all became, allies and woke, and we don't no longer have interpersonal discrimination, racial and ethnic inequities will still persist due to structural racism. So we can be well-meaning, non-racist, anti-racist, and we can still have structural racism. So I think, in our DEI training today, we have to look at addressing these structural factors to truly make a difference. Because if we don't, all of these one-to-one trainings and engagements will be it's like a tiny, tiny, tiny drop in a much bigger ocean that's affecting us today.
I really appreciate what you're saying, Dr. Lucy, on so many different levels. As a first generation professional, as a first generation student, as a mother of a male of color, to mother of two males of color, so many things are coming through my mind. I think that I'd like to take a moment to share your background in terms of the education you've had, because I think it's important that we also recognize that this is also part of the journey that you've had, not only as you came across this topic that you leaned into, but this, I'm assuming it was something that you lived and experienced as you went through your own educational journey.
Absolutely. And, I'm an immigrant, first and foremost. So that definitely is a huge factor of my background that informs my life work. I was born in Nigeria and I came to this country, to Oakland, California, at the age of 11. So I was quite young, but I spent both of my formative, years, if you can look at, 1 to 11 and then 11 to adulthood, in both East Oakland and in a rural part of, the country in Nigeria. So I had an exposure to how poverty can lead to negative health outcome. I was, as a child, I was quite sensitive. I was like, man, why do people get so sick? And then there's nothing that we can do to help them. And that helplessness fueled my passion to wanting to learn how to do something to help people when they're suffering. And I came to this country and I was shocked. We all, I'm sure this is a thing for every immigrant. We're always shocked that America is not this place of land of milk and honey. There's not,
Right,
it's
right.
not paved streets of gold, that people still suffer here, that people, the poverty and the destitutions that we saw in our country or origin are still affecting people here, right? Poverty and destitution does not have a geographical focus. It can happen anywhere in the world. And I saw once again that same issue where the most poorest in our society were being left out of just even basic access to care. And that's what led me to wanting to go to medical school to pursue a career in medicine. But my journey was even more complicated, as Yadi knows, in that I was an undocumented student, hence my, passion and connection to the pre-health dreamers and the wonderful work that they're doing. I was a pre-health dreamer before we knew what the pre-health dreamer
Future
was.
dreamers were.
We didn't even have the word for that, right? We were of the era of those kids that were fighting for the DREAM Act to be passed back in the early 2000s, and really navigating much of my educational system, process as an undocumented student, gave me this double exposure, right? Here I am, a Black woman, right? Because we know that anti-Blackness in this country and around the world is alive and well. There's anti-Blackness in part of how racism is perpetuated against Black people that's even more egregious than we allow ourselves to really talk about in this country. So I experienced that as a woman, as an immigrant, and as an undocumented student. And all of these gave me exposure and insight into the plight of those that I want to serve. I saw what it's like not to be able to actually exist, to be in limbo, right? Where you are living your life in fear of being deported, in fear of signing the wrong document, in fear of being at the wrong place, like the grocery store at the wrong time. All of these things were truly the catalyst that led to my professional journey. And, I fought hard, like so many young people are fighting hard this day, to let my background not be the thing that limits me, but be the thing that actually fuels me. And so
Ooh,
all of the work that I do and I will always continue to do is based on that foundation. I can never get away from that identity. And I bring it to me in every hospital room that I walk into, every hallway, every talk, everything that I do. It really comes from having that foundation.
I love that you're embracing that, Dr. Lucy. I really do, because I think so often we are, if we're going to be part of the society, that we're expected to lose some of that identity that makes us valuable to the community.
Yeah, and it's something that I really do want to encourage young people everywhere. The stories, your narrative, your journey, all of these things make you an asset to society. It doesn't take away. You are not a burden because of what you've lived through. You actually bring a unique insight that can actually change the world. And I tell my mentees and the students that I work with, lean into your story, lean into your struggles and the lessons that you've learned as a result, because all of these things have been preparing you before you even know it to the path that you want to be on. And it will help you navigate whatever life throws at you. You're battle tested, I tell them. You've already fought the battle. You fought the war. You're ready. And so the world is not going to beat you down because you've already been a survivor all along.
For us at Pre-Health Dreamers, that is always at the center of all of our trainings, all of our teachings with our students, because I think on a daily basis, I have to remind students just all of the skills that they're bringing to the table, all of the richness, cultural richness that they're bringing to the table. And so I just want to kind of ask you, Dr. Ogbu Nwobodo, for some clarification. When we're working with our students and even health professionals, and we see a lot of these trainings happen about cultural humility, come and get your certificate. I am so with you on, I really want to move above just that one time training. And now you're culturally humble. It doesn't work that way,
No.
right? It doesn't work that way, but I feel like I see that everywhere. Like, come and get a certificate in cultural competency, cultural humility. Correct me if I'm wrong. For me, this is a lifelong process, right? This is a lifelong assessment. Can you just tell us a little bit about that and what students really should be self assessing and how that's really important? And how do we feel about these one time trainings and what can we do once we leave these one time trainings? Because it's not the end of it.
Well, first, like I mentioned at the top of the hour, like I don't like these idea of these interpersonally focused ad hoc trainings that people are required to attend as now a badge, a tag of like completion. Now you're good to go. Go out there and no longer be racist. Go out there and be humble, right? And we have to go down to definition, first of all, of cultural humility. Because again, I'm a big fan of definitions and getting to the root of things. So, cultural humility was actually first defined and first coined in 1998 by one of my mentors, Dr. Jan Murray Garcia, and her colleague, Melanie Tervalon. They defined this as specifically what you said, Yadi, a personal, lifelong commitment to self evaluation and self critique. So, we all have to actually do this over the course of our lives to self critique, which is not easy, right? To look at ourselves, all of us who have chosen a path to help people, whether it's in education, whether it's in medicine, we are all usually think of ourselves as we're good people. We care about people. But to actually critique ourselves and look in the mirror and see the ways in which we may not always be adhering to our own principles is going to be a lifelong work. And it asks us to recognize power imbalances and dynamics, right? We live in a society, like I mentioned before, that has been stratified across who has power, who doesn't. When we encounter patients who have been seen as the other, right? The patient coming in there who's, undocumented or who's, a refugee or someone from a different sexual orientation or sexual gender identity. We already have in our society norms that says who has power and who doesn't. And we need to be very mindful of how we come into these spaces with power and how that can actually change the interactions that we're having. Promotes for us to really look at like how are we going to be interpersonally sensitive and learning from our differences. And then what I love about this, they talked about institutional accountability. This is no longer just that one, here's your training, here's your webinar, here's your small group talk, and you're done. The institution itself has to be held accountable, has to know that it needs to do work from a structural level.
You're listening to Inside a Career Conversations. Today we're talking to Dr. Lucy Ogbu Nwobodo. She's an assistant professor of psychiatry at the University of California, San Francisco. In this episode, you'll hear mention of DEI training. This stands for Diversity, Equity, and Inclusion. Dr. Lucy works with immigrant populations and the providers that care for them. It seems that the cultural competency conversation is more inclusive of the individual within a situation or an environment versus what we refer to in my generation as we were going into school and starting a profession was code switching, where the individual had to modify themselves for a particular situation, where it sounds to me like the cultural competency and structural competency is referring to beyond just someone having to change their language or behavior. It's now talking about a bigger environment having to make those kinds of changes. Am I identifying this correctly, or can you help me shape it?
Yeah, I think it's so important what you said, right? Because the onus for so long and truly even now has continued to be on those who have been historically marginalized to come into predominantly white institutions and spaces and conform and assimilate to survive. You have to blend in to be able to, even get in the door. You have to figure out how to make yourself as least threatening as possible, right? You have to
Right,
shrink
right,
and be subservient and bow down and acculturate just so you can be allowed to be in the room. And what we are saying, and people can consider this a radical assessment, but what we're saying is that it's no longer on those who are marginalized to do the changing. It is on the systems that have historically marginalized people. It is on them now to learn how to incorporate and be inclusive to everyone, where no one is told that who they are is not good enough, where there's one way to be, right? That to
right,
me is what I consider a white supremacy culture that allows us to focus on conforming to the same, ideological pursuits, to the same mannerism, to the same cultural ideas. All those things is now antithesis of what we're trying to do. It's
right.
no longer on you when you come in as a student in a white institution to blend in. The school should be figuring out how do we ensure that all of your voices are amplified and elevated, that you are part of the system as an equal. You're not there to add a minority quota. You're not there to make us look good on our website or to get our numbers up for some, licensing body. You're there because we value you as a true equal whose opinion, values, and background is seen as just as important as anybody else. And it's so
Absolutely.
important that we tell students that.
And I think that needs to be considered in not only outreach and recruitment for educational purposes, but I would even be as bold as saying for professional purposes, because there's individuals out there who are headhunters that are doing different things to encourage different populations to go into a certain sector of professions and are not doing that type of diligence that you're referring to.
And I think what comes to my mind is, working in higher education, it was a wonderful experience. But now looking back, I knew that I was always questioning our processes. Like, why are we doing things this way? And why is admissions this way? Or why is recruitment this way? And why aren't we doing something else? I always tell my students, it's like question everything, question it. But we also know that that can be so difficult and so draining, right? And I always tell institutions, it's like, it's not enough to matriculate or enroll or hire people of color. Because at the end of the day, all of our processes, if we're not questioning, they're very streamlined institutional protocols. And a lot of times I tell undocumented folks, I said, protocols and rules and regulations are there to keep you out. You're not going to be able to get in with all of this. So when you're hiring people of color, but yet you're making them and you're training them to implement rules and regulations, aka admission requirements, financial aid requirement, all of these things. People of color are helping implement these structures. And so I always tell students, it's like, if you want to go in there and change, you're going to have to question the system. And that can be so draining. Dr. Lucy Ogbu Nwobodo, how do you feel about wearing those two hats, that advocacy hat, that student hat, or that advocacy hat, and that health professional hat? How do you balance both? How do you juggle that?
I love this question because it is the constant battle that those who have been oppressed by our society are always asked to juggle. You got to fight for your people, right? You can't come in here and not do good work and be an advocate. And yet, people are just trying to survive. And so I want to share a quote. This is one of my favorite poets, Audre Lorde. She said, caring for myself is not self indulgence, It is self-preservation, and that is an act of political warfare. And I think
Ooh,
students,
okay. That
colleagues,
wake up to
workers,
that every day, Dr.
yes,
Lucy.
it's on my work, it's on my wall because I need to see that because I struggle. I struggle with this idea. Is self-preservation selfish? Am I giving up on my people by resting? If I want to take a break and not fight the fight, am I now a sellout? And we have to remind all oppressed people everywhere, not just in this country, your survival is itself a political warfare. You deserve to nurture yourself. You deserve to rest and make sure that you're focusing on what you need to do right now to get through whatever is being thrown at you. And I say that to lead up to your question because I have students all the time. They're in 7, 8, 10 different organizations that they're leading. They're doing
Mm-hmm.
a gazillion things, trying to save the world while being a student, while being a sister, a daughter, a son. And it's like the weight of the world is upon them. And it's so unfair that the onus is being put on those who already have to deal with so much. We are not forcing and we are not pushing the system to work as hard as those who are oppressed. And I'm sorry to get really loud about this because I see this as such a huge problem. We are constantly taxing the minority tax. We've all heard about it. We are taxing those who are already taxed enough to keep trying to save your people, volunteer at the free clinic, go do literacy for those who can't read. It's like, and what is the system doing for all of this? Right? We have to have a paradigm shift. We need to really shift and focus on the systems. I'm a big structural person because I believe that we have for so long, we have broken the backs of those whose backs are already broken, and we're placing more weight on them. So I tell my students, it's okay to just do your work. It's okay
Exactly.
to rest. You are not selling out. You are surviving, and your people need you to get through this. We need you to be okay. And don't feel guilty if you can only do so much. Yes, use your voice as you see fit, as long as you are not burning yourself out so much that there's nothing left for you. If you're burnt out, if you're dead, who's going to be left?
Who's going to be left
Right?
to move that?
And I
Yeah,
and I
yeah.
think with immigrants, we're always like, you have to work hard. You have to work hard. I remember growing up, and that was always the thing from my parents, like, you have to work hard and don't expect anything in return. And now I'm like, for immigrant families and for immigrant individuals, existence is resistance just on its own. Self care is really a revolutionary act for immigrants, especially undocumented folks.
I'm I'm really excited to have had this conversation with you because I'm currently working with middle schools to help them better define the student identity. And everything that you've talked about right now has been something that I want to, put in there for our sixth, seventh, and eighth graders to really start wrapping their minds around understanding microaggressions, understanding those micro insults and micro slights. Because I think it's important that while we talk about these types of systems being in place and being prepared for those of us that may be older, I don't know if we're putting enough time and investing enough time in our younger generation, understanding that what's happening to them is really happening to them. It's not, that was mean. No, it's not mean. There's a term for it. I really appreciate you coming in and making this very clear for not only my audiences, but also hopefully some of the parents that are listening to help instilling and in their homes some of this conversation as well, because we do need to have these conversations more openly with our children, with our family members, with our significant others, because that also is a big factor where someone can't be isolated in this conversation. They can't be fighting this conversation outward when they don't have a place to have this conversation inward as well.
Absolutely. And again, I'm so grateful for the opportunity to be here, with you all and to engage in this really very passionate and so important dialogue. As much as I want to encourage those who are listening, who are individuals, to be mindful of this, I'll be remiss not to say that a lot of this work needs to be done by those in power, needs to be done
Yes,
by those in
yes.
systems that have privilege and not always, on those who are the marginalized. So yes, take what you've learned, but let's also put the pressure on the structural changes that has to happen to make all of our lives better.
Thank you so much, Yadi, Dr. Lucy. You guys have provided some great information and insight today for some perspective that we need to continue to promote.
Thank you. Thank you for having me.
Thank you for having us.
Stay tuned for more insider career conversations that showcase career paths within immigrant community advocacy. We appreciate you listening and look forward to the next time.
Insider Career Conversations is a production of Juarez Consulting. For more information, you can visit juarezconsultinginc.com. This episode was produced by Sylvia Juarez Magana, with production help and editing by Kazmira Hall.